Good evening, everyone. My name is Sharika Morrock, and I am a licensed clinical social worker, and I am honored to serve as the mental health administrator for Bayou Mental Health. Thank you all for taking the time to meet with me today. I want to begin by expressing my appreciation for the work each of you do every day, whether you are providing direct clinical service, supporting clients through case management, working in administration, handling billing, or assisting with operations. Your contributions are essential to our success. Because of your dedication, individuals and families in our community are receiving the mental health support they need. Today, I would like to discuss our organization's business plan and direction we're taking as an agency. Specifically, I will review our vision, mission, organizational goals, financial priorities, and important ethical issues that require our attention. My goal is to ensure that everyone understands how their role contributes to both the clinical and financial success of Bayou Mental Health. Let's begin with our vision. Our vision at Bayou Mental Health is to create healthier communities where every individual has access to compassionate, ethical, and high quality mental health care, regardless of their circumstances. This vision reflects what we hope to accomplish as an organization. We want to be recognized as a trusted resource where people can receive quality care, find hope, and build healthier lives. Every interaction we have with clients should support this vision. Whether someone calls our office for the first time, attends therapy, or receives support services, they should feel respected, valued, and cared for. Our mission is to provide accessible, evidence-based behavioral health services that promote healing, resilience, and recovery while maintaining the highest standards of ethical and professional practice. This mission serves as our guide. It reminds us why we exist and what we are called to do every day. While we must pay attention to finances and operations, our ultimate purpose remains helping people heal and improve the quality of life. To support our vision and mission, we have established 5 organizational goals. Our first goal is to increase access to care. We know that many individuals face barriers when seeking mental health services. As an organization, we want to reduce those barriers by expanding telehealth options, improving scheduling processes, strengthening referral partnerships, and ensuring services are available to those who need them. Our second goal is to improve clinical outcomes. We want our clients to experience meaningful progress while receiving services at Bayou Mental Health. This means utilizing evidence-based intervention, developing quality treatment plans, monitoring progress, and investing in continued clinical training. Our third goal is to support and develop our workforce. Our employees are our greatest asset. We want to create an environment where staff feel valued, supported, and empowered to grow professionally. This includes providing quality supervision, continuing education opportunities, mentorship, and employee wellness initiatives. Our fourth goal is to maintain financial stability. As much as we care about helping people, we must also ensure that Bayou Mental Health remains financially healthy. Financial stability allows us to maintain staffing, expand services, invest in resources, and continue serving our community for years to come. Our fifth goal is to ensure ethical and regulatory compliance. Every service we provide must meet professional, ethical, and regulatory standards. Compliance protects our clients, protects our organization, and maintains the trust that the community places in us. Now I would like to discuss 3 important financial concepts that are essential to our success as an organization: collection, accounts receivable, and cash flow. Let's start with collections. Collections refer to the payments we receive after services have been provided. Simply put, collections represent the revenue that allows our organization to operate. When services are documented correctly and claims are submitted accurately, reimbursement occurs more efficiently. Strong collections support payroll, employee benefits, technology upgrades, facility expenses, and future program development. Without effective collections, even the highest quality organization will struggle to remain operational. The next concept is accounts receivable. Accounts receivable refers to money owed to the organization for services that have already been provided but have not yet been paid. When claims are delayed, denied, or submitted incorrectly, those balances begin to accumulate. As leaders and employees, we must understand that accounts receivable directly impacts the financial health of the organization. Delayed payments can affect cash flow and create unnecessary challenges. Accurate documentation, timely note completion, and proper coding helps ensure that services are reimbursed properly. The third concept is cash flow. Cash flow refers to the movement of money into and out of the organization. Healthy cash flow allows us to pay salaries, maintain benefits, purchase supplies, invest in staff development, and continue providing quality services. Even organizations that appear financially successful can experience difficulties if cash flow is not carefully managed. That is why every department plays a role in supporting positive cash flow through efficiency, accuracy, and accountability. I want to emphasize the financial responsibility is not solely the responsibility of the administration or the billing department. Every employee contributes to financial health of this organization. Timely documentation, accurate records, and adherence to policies all support financial stability. Now I would like to address an ethical issue that has recently come to my attention. As mental health professionals, we are held to high ethical standards. Our clients trust us, insurance companies trust us, and our community trusts us. Maintaining that trust requires honesty and integrity in everything we do. Recently, concerns have been identified regarding documentation and billing practices. Specifically, there have been situations in which the documented time spent with the client did not accurately reflect the actual services provided. In addition, there have been instances where billing codes selected did not appropriately match the services rendered. I want to be very clear. This is not simply a documentation concern. This is an ethical concern. If a clinician spends 30 minutes with a client, the documentation should reflect 30 minutes. If a service does not meet the requirements for a higher reimbursement code, then the code should not be used. Billing for time that was not provided or selecting inaccurate billing codes can be considered fraudulent billing. Such practices expose both the employee and the organization to significant risks, including audits, repayment demands, financial penalties, and damage to professional reputation. More importantly, inaccurate billing compromises the trust that clients and payers place in our organization. As your administrator, I want to make it clear that we will never prioritize revenue over integrity. Financial success achieved through unethical practices is not true success. To address this issue, we will be implementing several corrective measures. First, additional training will be provided regarding documentation requirements and billing compliance. Second, supervisors will conduct routine chart audits to ensure documentation supports bill services. Third, employees will have opportunities to ask questions and seek clarification when uncertainty exists regarding billing expectations. Our goal is not punishment. Our goal is education, accountability, and ethical excellence. Every member of this team has a responsibility to document accurately, bill appropriately, and uphold the professional standards expected of our field. As I conclude today, I want to thank each of you for your commitment to Bayou Mental Health and the clients we serve. We have a strong vision, a meaningful mission, and clear organizational goals. By focusing on quality care, financial responsibility, and ethical practice, we can continue to building an organization that positively impacts the lives of individuals and families throughout our community. I believe in the work we do. I believe in this team. And I believe that together we can create an organization that is clinically strong, financially stable, and grounded in integrity. Thank you for your time, your professionalism, and your dedication to the individuals and families we serve every day. I appreciate all of what you do, and I look forward to working alongside each of you as we continue moving Bayou mental health forward. Thank you.